सो हिप बोन इज़ लार्ज इरेगुलर बोन, ठीक है। साइड डिटर्मिनेशन के लिए हम ग्रेटर शियाटिक नोच के अंदर अपना थंब रखते हैं और एसिटैबुलम पर अपनी फिंगर्स रखते हैं, ठीक है। इस तरह से हम इसको पकड़ेंगे और हम कहेंगे कि जो इलियम है दैट इज़ डायरेक्टेड एसिटैबुलम इज़ डायरेक्टेड लैटरली एंड द सिम्फसिस ऑफ द प्यूबिस इज़ डायरेक्टेड मीडियली, ओके। और उसके बाद हम बात करते हैं अबाउट द इलियम। इलियम इज़ फॉर्मिंग द अपर पार्ट, ठीक है। और इस तरह से हम कहते हैं कि दिस इज़ द लैटरल साइड, मीडियल साइड, एंटीरियर एंड पोस्टीरियर, ठीक है। उसके बाद हम कहते हैं दिस इज़ द बोन ऑफ द लेफ्ट साइड। अब हम इसको एनाटॉमिकल पोजीशन में पकड़ेंगे। सो फॉर दैट द प्यूबिक ट्यूबरकल एंड द एंटीरियर सुपीरियर इलियक स्पाइन शुड बी इन द सेम coronal plane, okay, in the same coronal plane. Then we will say that the pelvic surface of the body of pubis it is directed backwards and upwards, yani backwards and slightly upward, okay. And then this is the symphysis, okay, symphysial surface of the pubis of the body of pubis that will lie in the median plane like this. So ये हमारे पास anatomical position होती है हिप बोन की, ठीक है। अब हम बात करते हैं about ilium. So ilium is fine. So ilium, it is forming the upper part of the hip bone and you can see that it forms the 2/5 of the acetabulum, okay. अगर हम बात करें about the ilium, we'll start with the iliac crust. We said it has upper end, a lower end and 3 borders and 3 surfaces. The upper end is called iliac crust, okay. It is the form of the crust which is called the iliac crust. If we talk about the curvature, it is convex upwards, okay, and then it is concave inwards in front and it is concave outwards behind. You can see the curvature. It's convex upwards, and then you can see it's concave. It's convex upwards. It's concave inward in front and concave outward behind. Then we talk about its segments. It has two segments: the dorsal segment and the ventral segment. The ventral segment and the dorsal segment. So if we talk about the ventral segment, we say that it has two lips: outer lip, inner lip, and intermediate area. And if we talk about the dorsal segment, we say it has medial slope and lateral slope that are actually separated by a ridge, okay. Then what we say is कि जो हमारे पास ये outer lip है, on that you will find the tubercle. This is an elevation and we say there is a midpoint, and behind the midpoint we have the highest point of iliac crust, okay. Now if we talk about the ends, it also has two ends: anterior superior iliac spine and posterior superior iliac spine, ठीक है। Next is R about anterior border. Anterior border is extending from the anterior superior iliac spine to the acetabulum, ठीक है। In between it shows an elevation which is called as the anterior inferior iliac spine and it shows a concavity above. Then we have posterior border. It is extending from the posterior superior iliac spine to the apex of the greater sciatic foramen. And it is also showing an elevation which is called posterior inferior iliac spine and it's forming greater sciatic foramen, okay, posterior border. Then we talk about the medial border. It is extending from the iliac crust to the ischiopubic eminence. This is the medial border. Now if we talk about the surfaces, we have the iliac fossa which is on the inner surface, a gluteal surface, outer surface, and a sacropelvic surface, okay. If we talk about the sacropelvic surface, we have an ischial tuberosity, an auricular surface, and a pelvic surface, okay. This is the convex margin of the auricular surface, and we can see that there is also a preauricular sulcus, okay. If we talk about this gluteal surface, we have three gluteal lines: an anterior gluteal line which is extending 4 cm behind the anterior superior iliac spine till the middle of the upper part of the greater sciatic foramen, and the posterior gluteal line which is extending 5 cm in front of the posterior superior iliac spine up to the upper part of the greater foramen, and the inferior gluteal line which is extending from the anterior inferior iliac spine to the greater sciatic foramen, and it is dividing the surfaces into 4 areas. If we talk about the iliac fossa, it is forming a lateral wall of false pelvis, and the pelvic surface of the sacropelvic surface of the pelvic surface, it is forming the lateral wall of true pelvis. Now if we talk about pubis. So in pubis we say that it's forming the and it's the antro inferior part of the hip bone. Firstly, secondly we say that it is forming anterior one fifth of the acetabulum. Okay. Now the pubis has a body, a superior ramus and inferior ramus. If we talk about the body, it has an upper border. Upper border is called pubic crust, and it is having laterally a pubic tubercle. Then it has three surfaces: the anterior surface, the pelvic surface, and the medial or symphysial surface. The medial surface is going to articulate with the pubis of another hip bone opposite pubis to form the pubic symphysis, and the pelvic surface is smooth. Now we talk about the superior ramus. The superior ramus has an upper border, an anterior border, and the inferior border. The upper border is called pectineal line. The anterior border is called obturator crust, and the inferior border. Okay, now if we talk about the surfaces between the superior border and the anterior border is the pectineal surface. Between the anterior border and inferior border is the pelvic surface, and between the anterior border and inferior border is the obturator surface. This obturator surface is showing obturator groove through which the obturator vessels and nerve passes through. Another thing about pubis is its inferior ramus. Inferior ramus, if we talk about the inferior ramus, it is going to be joined with the pubis of ischium to form conjoined pubo-ischiopubic rami. If we talk about the ischium is forming postero-inferior part of the bone. It is forming 2/5 of the acetabulum. Okay, it has a body. It has a body and three borders and three surfaces. The body, three borders and three surfaces. The anterior border, which is forming the posterior margin of the obturator foramen. The posterior border, which is continuous with the posterior border of the this is ilium. It is continuous with that. Firstly, it is forming the part of the greater sciatic notch. Then it is it is showing a projection which is called as the ischial spine. Then it is showing a concavity which is called as the lesser sciatic notch, and it goes down. And if we talk about the lateral border, the lateral border is forming the lateral margin of the ischial tuberosity. So the surfaces are the pelvic surface, the dorsal surface. The dorsal surface is forming the ischial tuberosity, and this is the femoral surface between the anterior border and lateral border. If we talk about the pelvic surface, that is smooth. If we talk about this ischial tuberosity is divided by a transverse ridge into upper area and lower area. The upper area is divided by an oblique ridge into supralateral and inframedial areas. And if we talk about the lower area, it is divided by an longitudinal ridge into outer and inner areas. This is the inner and this is the outer area, as we see. Okay, now if we talk about the conjoint ischiopubic rami, it has two borders and two surfaces: upper border, a lower border, outer surface and inner surface. So upper border is forming a boundary of the obturator foramen, and outer lower border is forming the pubic arch. The inner surface is divided into three parts by two ridges into upper, middle and lower areas. And if we talk about the outer, it is rough for the attachment of muscle. So now if we talk about the acetabulum, these is the margins of the acetabulum, and we see that the acetabulum is deficient inferiorly. The margin of the acetabulum is deficient inferiorly, and it is called acetabular notch. Then we have this is the non-articular part of the acetabulum, and here lies the mass of fat which is lined by synovial membrane, and this is the articular surface which is lunate surface. Okay, and we say that this is the margins of the acetabulum where the acetabular labrum is attached, and this is the articular surface with which the head of femur articulates to form the hip joint. If we talk about the obturator foramen, it's a large gap in the hip bone, and it's large oval in males and it's triangular and small in females. Okay, and it is closed by obturator membrane except at the area of here where the obturator nerves and vessels pass through obturator groove, which is called. So this is all about the hip bone, and you can see that the most important is it's in anatomical position, which is like this.